this is, before we get to your book, 26 years officially of this conference. The first year, I don't know, what'd you have, a dozen or so panels, and now you have, I don't know how many thousands of people walking around here. I mean, this is quite a whirlwind. Did you think it was going to last this long?
Well, this is my 51st year of putting on large conferences, and the goal here is choose your own adventure. That we put on finance, we put on healthcare, we put on tech, but here you're going to meet people you would have never met in your life as we try to get them to interact with others in a different walk of life. And it's an interesting thing. Chris Ailman, who's the CIO, Chief Investment Officer of Cal STRS, the second largest pension fund. He's the head of our global capital markets group, sovereign wealth funds, insurance companies, pensions, endowments, large family offices. He does not go to one finance panel. He goes to see the world.
Well, let's talk about some of those panels. I sat in on one today about the future of healthcare, about the research that goes in, not so much into curing things, but also the preventative measures as well. You have a think tank focused on this, and now you have a new book that really chronicles your own battles and your own desire to try to fix it.
Well, everyone's life is affected by health and medical research. It is the #1 driver of the world's economy. In the session this morning, you saw that in countries in West Africa, life expectancy has increased 50% in just 20 years. You now have grandparents, great-grandparents today, and it's really driven the world's economy.
We'll talk a little bit about that, because there are so many ailments out there that in years and decades past where, if not a death sentence, certainly the survival rate was low. So much has changed right now when it comes to various forms of cancers. You obviously went through your own battle with prostate cancer in the early 90s, 1993. I believe you were supposed to be dead in about 12 months to a year and a half, and you're still here.
I think they gave me 18 months.
How? How'd you get past that?
I would say I was extremely focused on driving science, not just for me, but for everyone. You never know when you launch programs whether it's going to affect you or others, but I was very focused on the microbiome in addition to Western traditional treatment. And we've recently had approved for cancer treatment and other treatments, giving one's microbiome to another. So you have a person that responded poorly to treatment, another person responded very well to treatment. By giving the microbiome of one to another, in Indian medicine, Ayurveda medicine, 5,000 years, they considered your gut your second brain. So everything you eat, drink, etc. But we never could sequence anything. And in '93, when we put forth these ideas, people said, prove it. You couldn't prove it. And as you know, if you go back far enough in time, in medical school, you never studied nutrition. Today, with sequencing, you can prove it, how you can adjust your microbiome. It starts to change within 7 days. And you could see it all over the world. In West Africa today, in Nigeria, for example, there's an epidemic of diabetes, increase in hormone-driven cancers, prostate and breast, because they changed, and with the addition of thousands of fast food that they didn't used to eat. In China, if you went to medical school 35 or 40 years ago, you never studied diabetes. Now China has more people with diabetes than any country in the world, and more people not treated who have diabetes. So you change the food system, you change your microbiome, and you change a country that was plant-based to one that's meat-based. It takes a long time of evolution to adjust.
Well, that's what I'm curious. How do you do that? Because this isn't just about, for regular people, about the science. You're dealing with just human emotions and our own preferences for things. We know how hard it is to get off of sugar or get off of red meat or things like that. That's just not something we can just snap our fingers and do.
Well, there are over 3,000 companies working on turning plants or vegetables into something else you think they are. And the challenge is they look the same, they taste the same. On Saturday night, we had our Global Gourmet Games. This is where we serve 20 different foods. You have to guess what they are, what's vegetarian, what's not. And the winning team generally gets about 25% right. So
25%.
So if you don't know the difference between bolognese that's made with tofu or bolognese with filet mignon, we can go plant-based. And you'll see at this conference, there's a big movement to bring the environmental movement and efforts together. Healthy planet, healthy human.
What about the socioeconomic differences? When we talk about making these lifestyle changes, when we even talk about the medical science needed to treat some of these diseases, a lot of this access to that has been for folks who are well off like ourselves. There's a whole class of people out there that for the longest time don't have those resources. They don't have the insurance and they don't have the money in order to be able to pursue that.
Right, well, we've spent decades working on this, and with us at this conference, maybe you'll interview him, is the head of health for Walmart. They have 4,000 pharmacies in underserved areas. 1/3 of the American public visits a Walmart or a Sam's Club. They've got 2.2 million of their own employees. So there's a different ways. And what did we learn during the pandemic? We have food deserts, we have health deserts, and we have financial deserts. And so we're very focused on this. And the other element that I don't think most people understand is there are states in the United States today where only 15% of the children are of European ancestry. So we just cannot have just Caucasians in clinical trials, or we're not going to deal with our population. You're in a state here in California where more than 50% of the children are from Latin American and another 10 to 15 Asian. And today in America, almost 11% of everyone not born here was born in Africa. That's come. So as our demographics change, the people we got to get in. So it is depressing that if you were in Midtown Manhattan, get on the subway, go to the Bronx, you have reduced average life expectancy by almost 10 years in a 20-minute subway ride.
It's interesting to see the evolution of this conference, and of course you mentioned the conferences that you put on at this very same location prior to the Milken Institute. This was the epicenter for really the growth of one new asset class that is now probably dozens, if not hundreds of different asset classes. When you look around this room today and you see these folks all invoking your name, all invoking what you and a small handful of other folks built out here in Los Angeles, are you happy with the direction that it's gone?
I'm happy. The first 25 years was focused on creating hundreds or thousands of new forms of security so you could finance businesses, and bringing those that were responsible for the creation of jobs and building companies with access to capital. Here, what we've done is we brought those around the world focused on access to capital, with those in the health and medical, with those in the philanthropic world, with those in the government world, with those in the technology world. Many years ago, I remember Peter Chernin, who was the number 2 person at what was News Corp, came here to be on a panel talking about Asia media, debating Sumner Redstone. But he spent the entire day in a session on doctors from Uganda, malaria no more, and I'd say Peter has probably spent 20% of his life since that day focusing on malaria no more. So it's kind of like that changing doors. We hope someone, when they come here, will walk into another place that they've never been and maybe change the world for it.